As already each and every podcast have its own insights and have its own value. But this podcast has my own personal value and personal insights because this podcast not only teaches you that where and how should we deal with patients, but also this teaches you how to maintain the personal relationship when even you leave the country and your patients actually remember you. That's the true meaning the doctor has gained the value. And here I am with my personal favorite, Dr. Preeti, who has been with me like from my first year of bachelor's in dentistry. She knows me quite well what actually I was doing during my bachelor's, but now we will understand together how the things run in Australia. What are the difference between India dentistry and Australia dentistry? What is the difference between the patient's understanding? How they have to maintain the anxiety of the patients and how they maintain the trust level of the patients outside the country, because that's the one of the most difficult thing that each and every doctor face somewhere or other in their life. So let's dive into the podcast and understand from her that how she maintained it, how was the journey, how is the journey after leaving India, and what all she learned and how positively she is getting. I was coming to you and sir and just watching things. I was on observership. So it was really great. But now, as you are working in Australia, I want that we will talk about it today, India versus Australia dentistry. But what's your experience and how it is going? So I want that you share your thought of view, how it is going. Okay.
Mhm.
So here we start with the first question, that what made you choose dentistry and was it always your first choice?
All right. So, Darshita, before I jump into the question, I just want to say thank you for having me. You've been really patient. You have been asking me to give you some time, some date, and I have, with really a lot of interest and excitement, I've wanted to do this with you. And thank you for waiting. And I just want to say that I have, just as you mentioned, that we've been observing you since you started your dentistry journey. And I will say that it's such a pleasure. We feel so proud to see you doing well, to be growing this way. And I think seriously, hats off to you. You're doing really well. And we wish you all the very best in this.
Thank you so much, ma'am. That's really means a lot. Genuinely coming from you, that's really means a lot. Thank you.
Coming to your question about, could you say the question again, please?
What made you choose the dentistry? And is it the always your first choice?
All right. So I think majority of the people will agree with me on this, that everyone wants to go into MBBS at some point or the other, and we somehow end up in dentistry. So that's how dentistry came to me as well. Yes, I did want to go towards MBBS and be a doctor, be a surgeon, but landed in dentistry, and I think I did the right thing. Now, when I look back at it, I went in the right direction, went to the best of college in India, and yeah, no regrets at all.
That's very great. But yes, that's true. And actually, in first year, we all have been asked this question. How many of you have wanted to
Yeah.
go to this? And it was
I
like,
know, and I think almost 95% of the people would raise their hands, and yeah, just 4 to 5% would be like, yeah, I wanted dentistry as my first
but to
choice.
be honest, I'm that 4 to 5%. I never wanted to go to MBBS
Oh,
because
okay.
because
So
of that night duties in hospitals and sleepless nights and everything. I
that's
really wanted to be a doctor, but I
true.
don't want to be like just working, 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 and there is no personal
Absolutely.
life. So that was
Yes.
something that I really don't wanted. So
Hmm.
I
Hmm.
think I was that 4 to 5% that I want to be a doctor and a dentist.
Yes.
And we are a surgeon because we do implant surgeries and all.
Absolutely.
So I got
Absolutely.
every
Yeah.
tag that I wanted, but
Yes.
yes, in my own field and in with my
Exactly.
own things.
Exactly. And dentistry can be very rewarding
Yeah.
if you, yes, if you get the right, if you start, get right mentors, you do some good courses, and you get the right skills, and it can be really rewarding at the end of the day.
Yes,
Yes.
that's very true. That's really true.
Yeah.
So looking back today, what has been the most rewarding part for you as being a dentist?
What has been, I am, I'm very empathetic. My nature is very empathetic. So if actually I see a patient who's come in with a pain and any discomfort, I actually feel their pain. I'm sure a lot of people do, but being able to help them out,
Yeah.
making them feel more comfortable at the end of the day, because dental pain can be really excruciating. So being able to help them out in any way, or even if it's cosmetic, being able to give them a good smile.
Yeah.
And I focus more on preventive dentistry. So getting in there when we can prevent the disease from going further. So yes, I think that is what I have been able to do over the years, and I wish to continue to do the same. So that's
Like when you told about the pain, I think in second or third year, they used to
mhm,
tell that you should take first injection as a dentist to know that how much pain or how much anesthesia is there so that you can
mhm,
understand the patient's psychology, what they
exactly,
feel. So,
exactly.
and when I was having one root canal pain, I was like,
Mhm,
I can't sleep. I don't know what else I have done because that time I was not having any knowledge ki chalo ketorol, let's eat ketorol, let's eat
mhm, mhm,
enjoflam or anything. I was not having any
mhm,
knowledge. I was just like
mhm,
started my BDS. So,
mhm.
but there was a pain and I can remember, and that pain was in first year, but I can still remember till now.
Exactly. So
So,
it's that bad. Yeah.
yeah. So
Yeah.
I
So
can,
imagine the impact that we have on people's lives.
yes,
I
yes,
mean, even the biggest of people can have this dental issue,
correct.
and getting it treated by the right person, getting help, it's such a big thing,
It's
right?
such a big thing. And when we give that pain relief to them, the smile
Hmm.
they have, I think that's the most rewarding thing we can get.
Yes, that's priceless. Absolutely.
Yes.
Yeah.
So, yeah, I've totally get you in that point. So, like, I have seen you working in India and
Hmm.
I haven't seen you in Australia, but I know
Yeah.
the difference. But what's the
Hmm.
major cultural shock for you in both of those country?
Okay, so I would just say that I'm fairly new to practice in Australia, so I'm still setting my foot over here. But from what I have been able to observe over the years, it's just that in India, I think still according to awareness, I
Yeah.
think there's a big, big step that people need to take towards dental awareness and oral health awareness.
Yeah.
Whereas over here, I feel people are much more aware when it comes to even the slightest of thing, gum gingivitis, gum conditions, or even the slightest of cavities. People are much more aware. So that has been really good change in people's awareness and people's mindset. That is very, very positive and very good. So I just wish that there was more dental awareness in India. And from what you're doing, I think it's only going to help people
Yeah, I
get
think
more
my
aware
main
and learn more
intent,
about.
yes, I think my main intent is that only, and behind this
Hmm.
podcast. And I did one with the one who is practicing in US here. And the thing
Hmm.
is that my main intent of the all the podcast is that people get knowledge And because I want to say them that even the small things matter the most, and if you
Hmm.
can take care in a small things, you will not regret it. You will be very happy that you took care in initial.
Exactly.
So
Exactly.
that's what my intent behind all the podcast is, and I'm very sure
Hmm.
with this one they will understand that why outer countries have more value of their oral hygiene, and what
Hmm.
uh, and why they have more technologies. When they ask that why outer countries have more technology, because they are more into such things, that the government is also there ki, no, we will do this for
We
our
have health
people.
insurances and all of
Yes.
that. Yes.
So I
Hmm.
think that's the point that we all, as an Indian, we should take it from us.
Yes.
Okay.
Yes. Absolutely.
Um, so, do you think there is difference between Australia patients and India patients?
Just what spoke about,
Hmm.
awareness.
Yeah.
They are much more education. Yes, there is a difference,
Mm.
and because they are more aware, they are much more educated about the importance of brushing, flossing, and if you sit down and tell them about what needs to be done, what is happening, they are a bit more. They're more receptive.
Mm.
They will listen. It's not to say that they will blindly follow you. And
Yeah.
because they are more aware and because they're more educated in that respect, they will take a informed decision. They
Mm.
will be, yes, so you can't fool them. You
Correct.
can't, yes. So that is not there. That, like in India, if a doctor tells you something, you have to do it.
Mm.
That's not there over here. Yes, it's like it's more of a shared decision making.
Mm.
So both the patient and the doctor, they sit down together and they talk about it. They weigh the pros and cons. That is very important here. So if we are putting any treatment option in front of the patient, we will tell them these are the pros of the procedure, these are the cons. You have to keep it transparent. You have to tell them if there are any complications that they can expect. That is very important. So you can't hide anything. So patients that way, they feel empowered. They feel that, yes, I am the one making the decision for my health. It's
Mm.
not the dentist who's telling me that you have to do this, you need to do that.
Correct. Correct.
Yeah.
Correct.
So that is a big difference that I see.
Difference. Yes. But somehow I feel in India, uh,
Hmm.
people are people are like, you tell me the decision and we will follow.
Yes. Because I think for a very long time, people have been used to that,
Yes.
that doctors, they were held at such a position that आप आंख बंद करके उन पे भरोसा कर सकते थे. You can still do that, but then it's important to let patients also feel empowered.
Hmm.
Like उनके भी rights हैं. They also have, they can choose what is right for them. You give them the options. You tell them what is right or what is wrong, and then you leave it up to them to decide.
Correct. Correct. Correct.
Yeah.
Very true. So, what is the biggest difference in the treatment planning when you say
Mm-hmm.
in both the countries? What, because I have seen how you plan in India. I know, and I
Mm-hmm.
remember, and to be very honest, I'm using that plan. So,
Yeah.
and it is helping me. It is really helping me
Mm-hmm.
because I always look up that how you understand the cause of the problem, and then you make the things easy for the patients and make them understand and make them
Mm-hmm.
feel valued. So I have
Mm-hmm.
seen those things, but now I want to understand how is the difference between the planning that you make in Australia and you used to make in India.
Mm-hmm. Okay, so I just want to say that the cost of the treatments, it
Mhm.
is there's a major difference,
Mm.
dramatic difference in what people are being charged in India and what people are being charged here. And
Mm.
that goes to say because of the skills, because of the cost of the materials, and there's so many things at play in Australia that the cost is justified to some extent. And that's why they need the health insurance to come in. So a part of the treatment fee is covered by the health insurance. A part of the fee the patient has to bear it.
Mm,
Okay. So when we put any treatment plan in front of the patient is going to consider everything. They will see how much their insurance is going to cover, how much they can pay, how much they can afford. Then over here for the really complex treatments like implants and FMRs and the more extensive ones, then some patients have to use up certain funds from that the government has set aside for them. So all these things are available for patients to use. So even that helps those patients who are in need of getting those treatments done. So they can access certain, which we call as super funds.
mm,
So they can access those funds if they want to get their treatment done.
mm.
So that all of that is very important. As you mentioned, treatment planning, sitting down with the patient, uh, taking intraoral pictures, showing them this is what is happening. This seems to be going wrong. This is what I would suggest that we do. And then making them understand. You can take multiple such uh, visits, multiple such consultations, and then telling them that this is how much you'll need to pay. This is what is going to be covered by your insurance, and all of that. So it's an elaborate process, but yes, we need to make sure that the patient has completely understood
Mm,
what is being told and what needs to be done and all of
mm. So, like when I was working in UK, I didn't work as a dentist for sure, but
that.
I worked as a dental assistant there. But
Hmm.
at that time, I was observing that how they used to work and what are the things that they used to keep in their mind and everything. So I've
Exactly.
seen that there were two types of treatments. One was
Hmm.
NHS, that was the
Hmm.
medical health care that used to pay, and one was the
Hmm.
private. And
Hmm.
both of them were having a different treatments. For
Hmm.
example, for instance, in NHS, they were going for amalgam filling,
Hmm.
but when we go to the private, they used to go to the composite filling. So,
Hmm.
does this all things happen in Australia also?
I don't know much about the government sector. I don't know how it is like in public setup. But in private practice, it's mostly there are certain parts, certain treatments that the Medicare, which is run by the government, some of it will be covered by that. Then you have certain benefit schemes, such as for children, child dental benefit schemes
Yeah,
are there.
yeah,
Exactly. Similarly, they have certain for veterans who have served in the army. So a lot of these different schemes are there so that everyone can take benefits of it.
yes, yes.
And then you have the health insurances also coming in.
Yeah, I think for the pregnant ladies also we have a lot of things. I think in outer country because of such benefits,
Mhm.
the people come more. They take the care of their self more.
Yes, absolutely. When you know, the other thing is for your insurance will not help you out later if you have not been doing your part. Every 6 monthly, if you are not going for your checkups, you're not going for your cleans, then the insurance will know that, oh, you're not taking care of your oral health. And
Oral.
later on, if you develop some condition, then they can always tell you that you were not doing your bit. So
Yeah,
they can also refuse. Yeah. So it's important for people, and that's why people take full advantage of it, and it's good in a way. So
it's good.
there are it's very good. There are so many times when we see patients who have pristine mouth, who
Correct.
barely have any deposits because they are so regular.
Correct. And actually, that's the truth. And it's a very good thing. It's a beneficial for each and everyone, as a doctor, as a patient, and as a government, everyone. So there
Hmm.
is something,
Hmm.
these rules should be there. So yeah,
Yeah,
that's really true.
I'm hoping it starts in India soon, but that will
It's,
only be helpful if people become more aware.
yes.
If people start taking care and going to the dentist every 6 months,
Mm.
that's when it will be.
Hmm.
The insurance company will still be able to make money.
Yes, I think the young generations are being more cautious about it because
Yeah.
of this Instagram, social media. Thankfully, they are
Mm-hmm.
giving a lot of reels on it, and
Mm-hmm.
this is being a positive and negative both, but positive is in much higher. So I think that's a really good thing for the people, for the young generation, that they are getting into it so they can take care of more ahead times.
Mm-hmm. Mm-hmm. Mm-hmm.
So what is the one aspect of dentistry that public rarely see or understand?
One aspect of dentistry
Hmm.
that people rarely see and understand. Can I say, with respect to dentists?
Yes.
Yeah, I think a lot of patients, they don't realize how stressful dentistry is. And literally, I think every dentist is is a perfectionist. Okay, some might be a bit more, some might be a bit less, but because of that perfection, because we have to look at such minute, we have such minute details
Yes.
on a small tooth. You're looking into the canals, you're doing such precision work that there is a lot of stress involved.
Yes. Yes.
So that is something that I think a lot of people overlook easily. They
Yes.
feel that, oh, there's so much money in this field, they're doing this treatment costs this much, and all of that. But they don't realize how much of strain it puts on our body, on our mind. So uh, there's a lot of thing that is involved in dentistry that is often overlooked by people.
Yes, I just want to do some cherry on top for on this thing,
Yeah,
that when we say that even 0.1 mm matter to us as a dentist,
yeah.
we never understood the value of this figure, but when we work on a patient, we understand the figure very well. And also we are dealing with lot of things. For example, the patient, because he is conscious. Secondly,
Mm-hmm,
he knows what is happening in my mouth. Even
mm-hmm,
single water that he or she can feel. Secondly,
mm-hmm,
need to take for the assistance, that how are they comfortable, because doing suction is never easy. I
mm-hmm,
agree to it, because I
mm-hmm,
have worked on that, or on that side also. The I
mm-hmm,
know how difficult it is, and
mm-hmm.
the tongue movement that
Yes,
patients.
there's so much that you have to take care, right?
Yes,
You have to make sure that the patient is comfortable. Um, they do not end up, your equipments do not end up hurting them anywhere. Their tongue does not get cut. And then at the same time, handling patients' anxiety.
yes,
There's
that's
so many patients. This is one thing that we hear over here very commonly. Our patients say that, oh, I don't like going to the dentist. I'm so anxious when I go to the dentist. So dealing with other people's anxiety, it rubs onto you. So
mm,
making them feel calm, that is another task. That
mm,
is another challenge for dentists, to
yeah,
make them feel calm, to make them feel comfortable. So all of these things, people, I think, often overlook it. People don't see it as such.
yes, that's really true. But here, I actually want to know that how do you calm a patient when such anxiety patients come to you? So how do you calm? First of all, your
Okay.
voice is so sweet that the patient automatically get calm. But still,
I guess that does help me a bit.
yeah.
Yeah, as I mentioned, the empathy,
Yes.
making them feel. So when a patient comes into the room, you make them feel like they're the only ones that matter. Okay? Leave everything aside. Leave everything aside. Give all your undivided attention to them. Okay?
Correct.
Because they are here in your operatory because of some reason, whether it's some cosmetic reason or they're in pain or whatever it is. So you make them feel important.
Mm.
Okay? And make them feel that, yes, you understand what they're going through. And don't just brush it off, don't just push it under the carpet. Validate whatever they're feeling and understand what they're feeling. So
Mm.
a lot of their anxiety goes away once you tell them that, yes, I understand what you're going through and that you're going to try to help them out to the best that you can. So all of that, I feel with kids, what we do over here, I think a lot of pediatric practices in India are also doing that,
Yeah.
that you have a screen up there, just play
Yeah.
something,
Yeah.
yeah, whatever they want. So the first thing I ask them is, which is your favorite cartoon? So we just put that up. They're sitting nicely, watching their favorite cartoon, and all of these small things.
Mm.
And then in the operatory, I normally have this really nice, relaxing music and some really good visuals on the screen. So patient is automatically they feel
Calm.
calmer. Yeah.
Wow. So, we are almost into our podcast, and here I want to
Mhm.
ask you that what is the one of the most challenging situation for you, like moving from India to Australia, that you have actually deal? Because moving one to another country is never easy. Leaving behind
Absolutely.
everything, leaving behind your culture, your friends, your family, your all loved ones, and it's not easy.
Hmm.
So, what's the
Yeah.
most thing that was challenging for you?
I would just say that we were into practice almost 10 years in India. So we were comfortable. We had a routine. We had a good patient base, a good running clinic. Everything was all good. But we made the move because we wanted better work-life balance.
Mm,
We felt that we need to give our family more time, our son more time. And this is one decision that we do not regret at all,
that's
having made this big move. Yes, so it all depends on the priority.
yeah.
Uh, People can have different priorities. Someone can have money as their priority, someone can have family time, all of that. So it was a difficult move. It was not easy. I mean, starting kind of like starting from scratch over here.
Yes.
Um, for me, I did part of my exam in India
Mm,
before moving here. So, which was the first part, I finished it in India. Came here. When I felt that we were comfortably settled in, that's when I started my part two journey of the exam.
mm,
So it was challenging. It
mm,
was difficult.
mm.
Now, I don't mean to demotivate anyone, but it does. बोलते हैं हिंदी में वो बोलते हैं ना कि निचोड़ लेता है.
निचोड़ लेता
So
है.
yes. So it literally um, gets the best and the worst out of you.
Yeah, for
And
sure.
yes,
And I think if
so
you will not go through this journey, so you will not get what you wanted. And
exactly.
you prioritize
And
what
then,
I understand is your work and your family.
yes,
You didn't
absolutely.
give up on both of them, and that's why you are here today.
Yes,
So,
exactly. So, um, the- if you don't go through that journey, you don't value this as much.
correct.
Once you're on the other side, as a dentist, you understand the value of this profession, of this life that you have now, and the responsibility that you have towards your patients. So I think that the exam just teaches you that, and
Yes.
you become so grateful
Yeah,
being on the other side.
for sure, for sure. Okay, so last, we just have four questions, which is quick fire round. Just a one word. Okay, you just need to choose scaling or extraction.
Hmm. I like doing extractions, but scaling is important
Hmm.
in order to prevent other issues from
Correct.
popping up. Yeah.
Private practice or corporate dentistry?
Private practice any day. Yeah.
India or Australia?
Can I say both?
One dental myth you want to burst.
One dental myth that I want to burst. There was this really common thing that I used to have patients saying in India, especially,
Hmm.
is that if we get cleaning done of our teeth, my teeth is going to become loose.
Yes.
I'm sure you must have heard that as well. There were a lot of other myths, like if I get my tooth pulled out, my eyesight will go.
Yes,
So
yes,
these are some really common myths that go around in India. So I just want to say that nothing like that happens.
yes.
And it is only when you have like heaps of deposits around your teeth, and once you get that taken out during the scaling, your tooth is going to be wobbly because of all the damage that has happened already.
Correct. One habit everyone should follow for a healthy teeth.
Um, Brushing twice a day, flossing, everyone knows that. But dental visit every 6 months, I would say.
Hmm.
Yeah, just to
One,
know that you're going on the right track. Sorry.
no, 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 no. Just a one last question for you. After
Mhm,
experiencing dentist in both India and Australia, what is the one
mhm.
lesson that has shaped you, not only as a dentist, but as a person?
Mm, Something that has shaped me as a person. Okay, let me think about that.
Can I say you something
Uh,
on this?
yeah, sure, please.
I think you have conquered the world with your smile, and you let everyone conquer their smile and help them to gain their confidence and help them to stand in the world where
Mhm,
they were somehow being very uncomfortable, and
mhm,
even the businessman and everyone else, but still they are standing up in a world because of their smile. This what
mhm.
I feel with your journey. And not only
Yes.
yours, even the sir. I really want to say that I really miss him. And I have
Yeah.
learned from him a lot, but I have learned these
Mhm,
things from you both. So this is
mhm.
my thought for you. But yes, surely I
Yes,
want
no,
to know you
absolutely.
more.
No, 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 I think what you said is absolutely true. And I've also realized that over the years that dentistry, it is a profession, and people should continue to pursue whatever their passion is. If it is dentistry that you're passionate about, or if it is whatever it is, continue to practice your profession. If this is your passion, then you're very lucky. But if you have something else that is your passion, then you should continue to pursue that as well alongside, so that you can be happy in both aspects.
Yes.
So I think I have been able to do that over the years. So I feel a bit more sane.
No, that's very true, ma'am. That's really
Yeah.
very true. But thank you so much for doing this, and thank you for
Oh, it
taking
was a
your
pleasure. Thank you
time.
so much.
It's been like, I
Thank you,
know
Darshita.
we have tried so many times, not today, not today, not today, but we
Yes,
finally did
yes.
it. Thank you so much. And genuinely, I have learned a lot and I'm still learning. And I
Mhm.
hope someday you will be proud and saying that, yes, she was the one that I have
I
seen.
I already am. I'm already very proud, Darshita. I mean it. I see your posts every day, and you are doing wonderful. You're
Thank
doing wonderful.
you.
And yes, I just want to say that even I have just started this journey,
Yes.
and we all have a long way to go. I'm also learning. I have a lot to learn, and yeah, I'm excited.
Yes, even me, and I hope we see each other very soon in person.
Very soon, yes.
Either
Yes,
Australia or
we will.
India. Both are okay
Yes,
for me.
absolutely. Oh, yes, yes, please come down. Come here.
I hope so. Hopefully, very soon.
Yes, yes, you
But
should, you
yes,
should.
yes, thank you so much again. And
Thank you,
hope we meet
Darshita.
soon.
Yes, absolutely. You take care. Bye.
You too, ma'am. Bye.
Bye-bye.